Hi, everyone, and welcome to this online talk on prescribed strengths. We're going to dive into essentials of strength training for health and longevity. I've done this talk in person a few times and just had a lot of demand for it, so I am popping it up online for you to view at your convenience with a cup of tea or whatever your drink of choice is. What are we going to talk about? We're going to talk about who can benefit from strength training. Is that you? We're going to talk about the barriers to strength training. So this is what I've heard from people over the last 10 years in clinical practice, the reasons, the most common ones, why people do not strength train. How does aging affect your body? We'll have a little look into the evidence. I'm going to focus a little bit more on muscle mass and bone density in this talk. What are the general health benefits of strength training backed by evidence? There's a lot of them. And then, can strength training help with healthy aging and longevity? Again, a little bit more evidence-based in this section. And then we'll get on to the practical tips. So how to structure a strength training session exactly for health and longevity. And we'll give really clear examples with pictures of what exercises you should be looking to include or aim to include in your strength sessions. At the end, I'll have a little discussion about some services I'm developing to help support this journey. And we'll also do a summary of important points to remember so that you can get started and have some useful information straight off this talk. Who can benefit from strength training? So World Health Organization recommends that everybody, all adults, do at least 2 strength training sessions per week, minimum. They're recommending about 30 minutes as well. In New Zealand, where I'm currently living, they did a survey in 2023 and they found that only 46.5% of people were meeting the World Health Organization guidelines. So over half of New Zealand wasn't meeting these guidelines. And I think it was even lower for women, around 41 or 42%, but I would need to check again. But just ask yourself, which half are you in? Do you get into strength training sessions or activities per week? And we'll go into exactly what that looks like later on. Barriers to strength training. So this is not from evidence. This is from personal experience with clients. I've been working in clinics for over 10 years full time. So I've seen thousands of people. And this is just the overall kind of consensus on why people don't strength train, and you may have your other points to add in. One of the main things is lack of knowledge overwhelm. Don't know where to start. Both are equally as much of a barrier, so having no idea where to start, or maybe you type into Google or your phone, I want to strength train, and all of a sudden you're bombarded with 20 different influencers telling you exactly what to do, and they all look different and a bit confusing. Don't feel safe in the gym. Fear of injury, a very real, very understandable fear. Fear of not getting the movements right, especially when you're adding load. You want the load to go into the muscles. You don't want it to get stuck in your lower back or your hip joint. So there's a little bit of learning of the movements to make it safe. Barriers to strength training, just moving on to some more misperception of what strength training is and who it's for. I think social media has a little bit to blame about this. We are inundated with crop tops or topless men, which is totally fine, but it is one type of person that strength trains and it does not represent all of us. Don't believe strength training is for someone like you. Maybe you've been into a gym in the past that catered for a certain type of people that were comfortable there and that just didn't fit you. Or maybe you've just been having a look at your phone and you're like, nope, I don't really fit in. Dislike the gym environment, more similar stuff, not comfortable, don't enjoy going to a gym. With these ones, I would recommend getting a friend to come along, or maybe a therapist or a coach that you're working with, going to the gym, just doing free trial. My tip to clients is always to do a free trial, have a sit on an exercycle if you're comfortable with that for 10 minutes and just scope out the gym, have a look around and see if you like the environment. And if you don't, it's okay. A few more barriers, obviously time to 30-minute sessions in the week. A lot of people are pressed for time already and they can't imagine adding more on top of that. So fitting it into your week already is really important, like perhaps going on your lunch break from work or going before work in the morning, or making sure you're not staying late after work and using that half hour that you would usually spend finishing off emails and things, getting out of there and getting in the gym. Not used to putting aside a time for yourself in the week. And this is a really common one, especially with women, because you can see that they might be looking after potentially kids and working and possibly even helping or looking after older parents as well. So being pulled in all directions, so no time for themselves. Cost of gym memberships. That can be a limiting factor. We'll just have a very brief look at how minimal equipment that you would need to do it at home. No gym nearby, depending on where you live. And a really common one is boring. I don't like the repetition. I'd rather go to like an exciting class with loud music and lots of different exercises. We'll talk about why the repetition is important based on evidence coming up. How does aging affect your body? We'll start off with bone density. So your bone density increases up to the age of 25. From 25 to 50, it remains the same in both men and women, as you can see on the graph. And then bone density starts to reduce after the age of 50. And we can see in women that it has a sharper decline around menopause, which can vary from woman to woman. Moving on to muscle mass, so what naturally happens to us. Muscle mass declines with age. Our muscle fibers atrophy, get smaller, and we also reduce the amount of muscle fibers we have. How fast does this happen? There is no need to panic. We're not going to fade away super fast. We have plenty of time to take action. We lose our muscle mass after the age of 30, about a rate of 3 to 5% per decade. So every 10 years, it goes down 3 to 5% if we don't do anything about it in general. The process speeds up once you go over 65. By the age of 80, you can lose up to 8% of your muscle mass per year. Now, this takes into account maybe 80-year-olds that are more inactive. So you can definitely be fit and healthy and not have this sped up loss of muscle mass at 80. Compared to someone who sits down and doesn't move much, they will lose muscle mass faster. So everyone is different. A nice example is the picture above. This study was done on men, and it looks at muscle mass with aging and the effect of activity. So not strength training, just walking. So in the study, they classified an active man as someone who did 10,000 steps per day. And they described a sedentary man as someone who did, I think, between 1,500 and 2,000 steps a day. So just not moving as much, no strength training. 24-year-old man, he was 76 kg all up, and he had a lean body mass, so muscle mass of 57 kg. So a lot of him was muscle. At the age of 66, they looked at a man, sedentary, who did not move around much during the day. His body weight was similar-ish to the 24-year-old, 81 kg, but he only had 13 kgs of muscle mass. And this is just a 66-year-old man. You can see from the pictures, just so that you can figure out, in the picture, this is looking at your thigh, your hamstring muscle. So if you, like a slice of ham, if you sliced down through your thigh, and then you looked down up on it, the little white dot in the middle is bone. The deep red stuff around it in the first picture, labeled C, that is muscle. And then the thin white layer on the outside of C is fat. And you can see between C, the young man, and D, the older man who was 66 and not active, you can see the difference. So the muscle looks more broken up. There's less of it, and the fat is taking over and it's infiltrating the area that muscle used to be. Now, if we look at an older man who is active, doing 10,000 steps a day, we can see that his muscle mass has definitely maintained a lot better than the man who doesn't walk and move as much. He's 79 kg and his muscle mass is 36 kg, so almost 3 times more than the man who just wasn't walking. So if in doubt, walking is one of the best, most accessible ways that we can all stay fit and healthy and support our health. Benefits of strength training. So just to look back on that one, yes, the active man did have increased muscle mass because he walked more, but you can still see that there was a significant reduction with age. So he went from having 57 kg to 36 kg of muscle mass. Now, is there anything else we can do to improve that? That's why we're looking at strength training. Sorry, I'm just having a cup of tea. My voice is going. There are lots of documented benefits of strength training. I'm not going to go through them all in depth. When we look at physical health, there is evidence for increased or maintenance of bone density, increased musculoskeletal health, so that's just our muscles and bones, increased muscle mass, so we have more muscle, and a reduced risk of heart disease, heart disease, type 2 diabetes, and arthritis. Reduced risk of chronic disease, sorry. And this can be a little bit linked to more. We can have more muscle mass, less fat. It helps our metabolism. If you want to discuss these kind of areas, you'd be more get more answers from your GP or a clinical nutritionist. Looking at mental health side of things, it has shown, so when people strength train for 12 weeks, 12 to 15 is usually in the studies, and they do questionnaires before and after, they've shown significant increase in mood, reduction in stress, improvement of self-esteem, and improved body image. Getting into the nitty-gritty, I'm going to start with the most exciting bit and the most promising bit for us all. Can strength training help with healthy aging and longevity? And when it comes to muscle mass, it can. So in 2019, there was a systematic review. So that's the highest level of academic evidence that we can have today. It looks at a big group of individual studies and pools their results together. This saw that women who strength trained for 15 weeks and did 2 to 4 sessions per week of every exercise they did 3 to 4 sets of it. They had a 3.3% increase in muscle mass, which is about 1.45 kg. And that happened over 15 weeks. And if we think back to the other evidence where we looked at our rate that we reduce muscle mass is about 3 to 5% per year, this research and evidence shows that we can definitely combat that muscle mass loss, and we don't need to lose as much as we age. We can see here, it's just another nice little picture of, we have a 40-year-old triathlete. So again, this wasn't looking at strength specifically, but they were looking at active people. So 40-year-old triathlete who cycled, swam, and ran regularly. And then we have a 70-year-old triathlete, and you can see that in those 30 years with continuous training, it is possible to maintain muscle mass. Then if we look in comparison in the bottom left corner of the picture that shows the muscle, which is a dark reddy stuff, the white stuff is fat around it. So this is the thigh, again, looking at your thigh muscles. You can see that the fat is taking over a lot more of the thigh, and that's also infiltrating the area that the muscle is. So that will result in reduced strength and functional ability at some point. The second most interesting one I found is looking at bone density. So can strength training help with healthy aging and longevity in this area? Again, we have good level, high level evidence. We have a systematic review that looked at a big group of studies. And again, they showed that resistance exercises 2 to 3 sessions per week over a 1-year period, so a longer duration to have an impact on bone density. And they showed that in this group of postmenopausal women, it increased or maintained bone density. And then when they took another separate group of the studies, they had found that in certain groups, it increased bone density significantly in most participants. Now, the important thing here is that they combine strength training with some type of weight-bearing aerobic exercise to get these results. So it's not just strength training on its own. It was most effective when combined with activities such as skipping, jumping, running, hopping. So high impact, which a lot of us, as people get older, they start to leave out of their routine for fear of injury often. Another one that I didn't do a deep dive into the evidence of, but I assume is an important issue for a lot of people, a lot of women, improved weight control. So you could see from the pictures back a little bit that the ratio of muscle to fat gets changed depending on our activity levels. So if we're not active, we have way more fat and adipose tissue than muscle mass as we age. And if we are active, we can reverse that balance or improve that balance. So we have more muscle mass. If we have more muscle, our metabolism is better and we burn calories faster. So it should make it easier to lose weight. Again, this is going into more clinical nutritionist or GP advice that you would look to get more detailed info in that. What exactly do we include in a strength session? So I'm creating some online and in-person services, and I've been creating these based on evidence. I'm just going to share what I will include in them with you and what you can include in your workouts. A warm-up is important. You want to warm up the joints that you are going to need to move. So you pick some stretches, usually dynamic ones in the warm-up, so you're moving in and out of them. And you might also do some exercises to activate certain muscle groups, like a hip bridge to activate your glutes, or a little banded pulling the arms apart retraction to turn on the muscles at the back of your shoulders. So little activation exercises and getting your joints moving that you need for your workout. Then we'd move into the main body of the workout, and this would be in sections 2, 3, and 4. So you would need leg exercises, upper body pull exercises, and upper body push exercises. For the leg exercises, you could pick 2, and they would be either squats, lunges, step-ups, something with a hip hinge, which some people might know as deadlift. Lots of ways to do it. It doesn't need to be really hard starting. And I love calf raises, so I would throw them into the mix. You would also have usually one exercise they use both legs, so say a squat from a bench or a chair, and then one exercise that is unilateral, so that will challenge your balance a little bit as well, so like a single leg calf raise. And then we learn to add weight to them. The second bit of your main strength workout would be upper body pull. And these exercises are really important for our back muscles, improve our posture, and reduce risk of injury with lifting and things, because these back muscles can take a lot of load if we can engage and train them. We'd be looking at lat pull downs, rows, bicep curls, pull-up variations, and I have down a posterior delt fly. It just works the muscles at the back of your shoulder. Section number 4, so this is the last part of the main body of the workout. It would be upper body push. You would look at exercises such as push-ups, bench press or floor press for more stability, shoulder press, which just looks like an overhead press with weights of some kind, and a tricep press, which is just straightening out your elbow against resistance. So they would form your push. I would usually choose 2 exercises from each category to make a full body workout. So 2 legs, 2 pull, 2 push. And then you're going to repeat those exercises for 3 to 4 rounds, if we're looking at the evidence. Every exercise, when you're starting off, you'll be doing it for 8 to 10 reps. Then finally, you come to a cool down, and you can have this as long or short as you want. So probably 10 minutes where you wind down, focus on your breathing, and you're doing some slower, more relaxed poses, like stretching out the back of your hips in a pretzel stretch or doing a child's pose. I'm using some yoga terms because that's what I'm used to, but you might use other words for those. So that's a basic look at how you would structure a strength session. So feel free to take a pic of this one or take some notes. And then if you're like me, I'm very visual, so I just need to see some pictures. I'm just going to run through it in pictures with you. So your warm-up is dynamic, moving the spine, activating maybe our glute muscles and our back muscles, or whatever you're going to be using in your workout. Then getting into the main body, legs. So working with the lady in the blue, we're doing a squat. The second one, we're doing a hip hinge movement to work the muscles in the back of the legs. And the third one here, we have someone doing a single leg. So it's a step up. So challenging our balance and our stability whilst working our legs. Upper body pull. They will look like things, lat pull downs, which you can do in the gym, rows, and then pull up variations where you're hanging. And there's lots of modifications to start these exercises at a level that suits you. If you do not have access to a gym, the number one, actually I've got one on the floor beside me, the number one piece of equipment I would recommend is a power band. You can get them in New Zealand in Woolworths. You can get them from most physio practices. They can order them in for you. They're just a stiff rubber band, and they're really good for doing all the pull work if you have something to tie it to at home. Otherwise, the cable machines and the suspension trainers in the gyms are great pieces of kit to start safely on your strength journey. Upper body push. Sometimes this is the hardest one. So we start with push-ups. If you can't do a full one on the floor, you can start with it hands on the wall doing a push-up, hands on your kitchen worktop doing a push-up, hands on the coffee table doing a push-up. The lower your hands go, the harder it gets. So a really good one to start with. And then in the gym or at home with free weights, you can do overhead press or a shoulder press. The girl in the pink is doing one in the pink and blue pants. A tricep press, the lady in the middle just straightening her elbows out with the rope. Again, you could do that with one of these resistance bands. And the shoulder press you would need, or the bench press, where you're lying on your back on a bench or the floor and pushing the weights over your chest and then bringing the arms back to your armpit. That would be the 4 main push exercises, and there's lots of variations to suit everyone. Then your cool down is a little bit more chilled and relaxed. Slow stretches with the main focus being on your breath. That's a lot of information. Hopefully it was useful. We'll do a summary in a moment. At the minute, I'm developing some services to offer to support people that want to strength train or start strength training for health and longevity and that need a bit more help than doing it independently on their own. In Christchurch, we're running an in-person 6-week course, which we've just started. It's fully booked now. We will be starting more courses after Easter. There's only 6 people per class and it's in a private gym. We'll see. It's a little bit limited with times and things, so it suits some people, but not everyone. The other service I'm developing that should launch in April is a 6-week online course that will be app-based. When you open the app, it will give you 3 workouts per week. So on the day that you're meant to be doing your workout, it will pop up with the workout with videos of me doing them, a written description, and then you tick them off as you go. Now you got some accountability because I can see you ticking them off. And then you'll have access to message me directly. If an exercise doesn't suit you, I can swap it out. Example, if a certain type of squat triggers knee pain for you, I can give you an exercise that will not load your knee joint. So it's not a service for rehab. It's a service for building full body strength for health and longevity. Rehab, you'd be better off dealing with a physiotherapist or someone working in that field. Also, we'll be doing some more info evenings and free talks. If you have a group that is interested, please let me know. Happy to look at working with community, charity, or corporate groups. You can just email me to book. Main points to remember, a good little slide for you to take a picture of. How many sessions should you be doing a week to get the benefits? 2 to 3 sessions. I'd always start with 2 and see if you can get consistent with 2 first. How many exercises per session do you need? You need about 3 to 6 exercises. So you could either pick 1 leg, 1 pull, 1 push, or you could do 2 of each of those. How many repetitions of each exercise? Aim for 8 to 10 repetitions. Listen to your body. When you're starting off, things mightn't want to work for 8 or 10 reps, and that's okay. You just work your way up to it. How many sets? So you're going to do your 2 leg exercises, do them for 8 to 10 reps, and you will repeat that 3 to 4 times. Again, I'd start off with 3 sets and see how you go. How long will it take to work? It's not a quick fix. It will take 12 to 16 weeks to scientifically have any impact on your muscle mass, and you're looking for longer, so up to 12 months of doing it consistently to affect your bone density. So this is not a quick fix, but it is an effective long-term health strategy. Will the journey be a perfect linear improvement? Oftentimes people start strength training and they get pissed off or frustrated because it does not give them the results that they want in the time they expect. So managing your expectations are really important. You need to be patient with your body. If it hasn't trained in a long time or it has done a lot for you, like doing a physical job or maybe long hours in a sedentary job or having kids, then it's done some things for you, and there might be areas of your body that are just not used of working well or taking load. They might get a little sore when you first start strength training. You need to listen to your body and tweak your program, or tell whoever you're working with guiding your program and ask them to change it. You'll come across other obstacles as well in your journey. So illness, time restraints, family, work, travel, life does get in the way sometimes, and that's okay. The important thing is that you acknowledge, oh, I've been away from strength training. And when you go back, you start back at the beginning again and be kind to your body and build yourself up gradually again. If you're away from it from 4 weeks, you need to go back to the start and give your body a chance to get back to the level it was at again. Thanks so much for listening if you have got this far. If you have any questions, feel free to email me, hello@physiowithsarah.com, and feel free to share the link to this talk.